And it sounds like the test and understanding if you have a good innate immunity, I mean, that's not a COVID thing. That applies across the board because you're really testing to see how well do you clear things. So God forbid if it's, COVID 2.0, that's a variant. If it's, the flu season, that's going to maybe be a lot worse because it was quiet this year. Who knows? That stuff is a litmus test or an assessment of really just your upfront, immunity at this time. Yeah. But I really should, again, this is theoretical and extrapolated, but I should probably test it again in 10, 15 years to make sure that it, because the phenotype or the expression may get worse over time.
Actually, on y'all's site, Doctorpedia recently said, never in our history has a single disease brought, the amount of scientific questioning or great scientific minds coming together trying to figure something out. I'm certainly not in that group, but it has been fascinating to watch the amount of discovery. And so obviously COVID has been terrible across our world and sort of disrupted life as we know it. There have been some good things. So like some of the scientific discoveries that have happened over the last 12 months wouldn't have happened.
Right. They were accelerated.
Yeah. And so, the mRNA vaccine coming out, that's scientifically, that's incredible.
Right.
Obviously we were not expecting this, but to your point, these receptors appear not just predictive of COVID. That's the beauty of it, is it's part of innate immune system. It's now, we're studying it to influenza, upper respiratory infections in general, viral, included, all of those. And so like it should stand true. Even if there's, another viral outbreak or another new novel virus or a mutation of this one that changes, these results should still stand true.
Right.
And so like...
Because again, you're not testing an antibody or memory, right?
It's not a medication. It's not a treatment. It's literally information that you're giving people.
Yeah.
And so that's been, one of the great points of this recently is I've worked with this company, Phenomune, to distribute this test, which is, inexpensive but available to everyone so they can know what group they're in.
Well, I was going to ask, because I've gotten the test for my family members and I've gotten different ones on Amazon, but I read the one that you were talking about, the data with the 94% concordance and it looks at different things. That is Phenomune with the PH, correct?
Yeah.
Because I do want my, it's important to me, especially when we visit, grandparents and extended family members. It just kind of, again, gauges your level of responsibility.
Cool. It calculates it for you. That's kind of the beauty of this new one. So Phenomune uses, it's a series of tests, but it automatically calculates what group you're in. It then is going to be tailored towards increasing expression per your level of expression, and so like ways that you can improve it. And so the company
specifically,
so the company's done a great job at give people information, easily, but then also how can we help them in the future? And so
that's ultimately why you did all this. At first, you wanted to help people with sinusitis. Don't know how much you cared about the rats, but then you're thinking if I can have some application, rats are, I hear they're much cleaner than this.
That's kind of the has been awesome.
My name is Dr. Sanjay Juneja at Doctorpedia. If you're finding this information valuable, click here for more content.